celebration here. So we can start with that. So I will be talking about natural and personalized weight loss, and I have been helping patients again with this for many years now. So next slide. So this is not about vanity and just losing weight to fit into your tight jeans, okay, or to be able to wear those leather suit for vanity's sake. This is more because obesity has very definite health risks, okay, and those are right from high blood pressure, cancer, bladder diseases, renal failure, stroke, heart failure, atherosclerosis, and non-insulin dependent diabetes mellitus. So next slide, please. So in Ayurveda, we talk about how all of us are made up of solids, liquids, energy, gases, space, or what are known as earth, water, fire, air, ether. All of us have all of these components, but the proportion of these is different in different people. Some people have more water and earth and less of the other three, and their mind-body type is seen as Kapha, or what in today's day and age is known as type B personality. Some people have more fire in them and less of the other ones, and they are known as Pitta, or what in today's language is known as type A personality. And then some people have more of ether and air, and then they are in Ayurveda known as Vata, or in today's language they are called as non-A, non-B personality. So we have all those three, but the levels of them are different in different people, and based on that then, okay, we have various expressions during health, and we have various risks of health problems. So next one, please. So people who are more water and earth are, as I said, Kapha, and so they are heavy, slow, they have more moisture in them, they are very stable, they have more coolness in them. And in terms of obesity, these people have higher risk of obesity, the Kapha predominant ones. Okay, the Pitta, the more predominant in fire, they have qualities like hot, sharp, reactive, and then they have medium risk of obesity. Whereas the Vata, who are more predominant in ether and air, they are more dry, they are more light, okay, they are fast in their metabolism, so they have very low risk of obesity. Now this science goes into much more depth, okay, but we don't have time for that. So next one. So these concepts of Vata, Pitta and Kapha are not just limited to Ayurveda, which originated 5,000 years ago. This has been there throughout the human civilization in all the parts of the world, and there, like the psychotherapist right here in Bay Area who coined the type A, type B, non-A, non-B, or 3,000 years ago in China, they talked about the concept of Qi, Yang and Yin. Now mind you, Ayurvedic Pitta is not 100% same as type A, or that is not same as 100% Yang, or the mesomorph that the Europeans talk about. That is about a good 70% overlap in this. So there are some cultural individualizations, but they are similar concepts. So the concepts are same, the labels or the language is different. Are you guys with me? So this has been well accepted, whether it is east or west, whether it is 5,000 years ago or just 50 years ago here in Bay Area. These concepts have been well known that human beings don't come in standardized size and shape and metabolism, but human beings come as individual mind-body types. So the next one. So once you find out what your mind-body type is, then how do you address obesity? You don't give them another diet pill, or you don't ask them to do certain types of, give me a week and I'll take off the weight, that kind of a gimmick. You get into a more comprehensive plan, and which is customized. So for example, okay, there is lifestyle guidelines both for morning routines and evening routines. There are certain guidelines about diet, there are certain natural, clinically proven herbal formulas, and there are some specific treatments done by the person themselves and with the help of professional help. But this is not again one glove fits all. So you do not take 10 people, okay, who have 20 pounds extra and stick them, okay, with one program. Oh, call us at 1-800 weight loss, and then we'll send you the same package that everybody takes for a certain time, okay, and then expect the weight loss. No. The problem happened differently for different people, so the solution needs to be put together individually for each person. So we have a general guideline, but next slide, depending upon the predominance of their mind-body type, we do changes. So for example, the same one that you saw earlier, okay, we will be changing it for the air and ether predominant, or what is called as the chi predominant, or ectomorph or vata person. We will change it, individualize it for them. For example, these people will have to avoid brassica family foods. Okay, they will have to, for them, some dairy and fish is okay if they are non-vegetarians. They will need slightly lesser amount of water. Their dosage is slightly lesser. They will not be doing the faster breathing. They'll be doing the relaxation breathing. So we customize everything for them, whether it is their diet, whether it is their dosage of the formula, whether it is the relaxation techniques that they do. Next one, please. So the fiery people, or the type A personality, or the yang predominant ones, okay, for them, okay, we will have them only 1 ounce of this formula, because they have softer bowels. Namaskaram. Please make yourself comfortable. And then they will need only medium amount of exercise is what they will need. Then the next one, the more earth and water predominant. These guys have to really work out. These are the couch potatoes. Are any of them sitting on the couch back there? No. So these are the couch potatoes. So we make them no relaxation breathing. So we ask them to do bellow breathing. Okay. So these are the people we ask them to meditate, and because they are more earth in water, as soon as we ask them to meditate, they become one with the earth and they start chanting. That's their favorite chant. Okay. So for them, okay, no sitting meditation or lying down meditation. We ask them to do walking meditation. They need to be doing more movement. Okay, because once they sit on that couch, it will be very difficult to stir them. They need a higher dosage of the medicine. Okay, and so they have to avoid dairy. So there is a lot of customization and personalization done based on the predominances of these governing factors, that is earth, water, fire, air, ether. Now everybody has all those 5, but the proportions of these are different in different people, and the imbalance is also different in different people. So you have to customize it for each person depending upon what is going on. Next one.